If you're 60 or older and you love seeds, sunflower sprinkled on salads, a spoonful of tahini, chia in your yogurt, please hear me for a minute. A habit widely praised as healthy can, in certain contexts, quietly increase vulnerability to low-flow brain events and neurological instability. I'm Dr. Emily Carter. I work with older adults every week, and I want to give you a clear, practical look at why those tiny seeds that feel so wholesome may, for some seniors, nudge the fragile systems that keep our brains well perfused. This is not a call to panic or to vilify food. It's a call to understand how aging changes tolerance and how small, fixable habits can protect brain function and independence. In the next several minutes, I'll explain the core physiology you need to grasp, then walk through the seeds people actually eat and what each one can do in an aging body. I'll offer concrete, low-friction steps you can take today. How to prepare seeds, how often to eat them, what to read on labels and what to avoid. If this matters to you or to someone you care for, hit like and subscribe. I share practical, evidence-informed tips each week for people over 60 and the families who support them. First, a brief physiology primer. Think of the brain as a precision instrument that depends on steady, predictable blood flow. Young vessels have reserve. They dilate and constrict to keep blood flow constant despite changes in blood pressure, hydration, or minor inflammation. As we age, that reserve narrows. The small arteries and arterioles that feed brain tissue become less flexible. The mechanisms that normally guarantee stability, chemical signals that tell vessels to relax, mitochondrial energy inside vascular cells that powers their responses, and circulating minerals that buffer pressure are all less forgiving. Put simply, the older brain tolerates less noise. By noise, I mean small cumulative disturbances that together reduce effective cerebral perfusion. A little inflammation here, a tiny change in blood thickness there, a small dip in pressure after standing up. That ensemble can produce what I call vascular noise. Individually, each change may be inconsequential. Together, in a person whose vascular reserve is reduced, they can make the brain more vulnerable to low-flow stress. Low-flow stress doesn't necessarily mean an arterial clot. It can mean minutes of underperfusion that show up as lightheadedness in the morning, afternoon fog, brief balance loss, or a tendency to feel unsteady when getting out of a chair. Those are the subtle clinical signs I watch for. There are a few physiological threads that recur across different seeds, and you'll hear these referenced often. First, nitric oxide. This molecule, produced by the endothelium, the inner lining of blood vessels, helps vessels relax. Anything that reduces nitric oxide production or its effectiveness narrows the margin for safe blood flow. Second, minerals, particularly magnesium and calcium, help buffer pressure changes and participate in the fine-tuning of vascular tone. Substances that bind or reduce the bioavailability of these minerals can blunt that pressure buffering role. Third, hydration and blood viscosity. Some foods can draw fluid into the gut or absorb water, and if someone is underhydrated to begin with, those shifts can thicken circulating blood. Thicker blood requires the heart and vessels to work a bit harder to supply the brain. Fourth, autonomic regulation, how your nervous system adjusts heart rate and vessel tone in response to changes, is vulnerable in older adults. Small pharmacologic or dietary influences can increase blood pressure variability. Finally, mitochondrial energy in vascular smooth muscle cells matters. If mitochondrial function is impaired, vessels don't respond as quickly or effectively. These are the basic mechanisms we'll refer to as we look at seeds one by one. The language I'll use is intentionally cautious. These seeds do not cause stroke in every older adult. Rather, they can contribute to physiological patterns that increase vulnerability to low-flow events in people whose reserve is already reduced. The clinical picture is often subtle, and standard tests, an MRI without clear blockage, routine blood pressure readings, might look reassuring while a patient still reports dizziness or brain fog. That's why careful dietary and preparation adjustments can have real, practical benefits. Let's start with sunflower seeds. They are everywhere. A topping in salads, an ingredient in granola or trail mix, a crunchy snack by the handful. Nutritionally, they provide vitamin E, some protein and fats. The central issue in older adults is their high content of omega-6 polyunsaturated fats. Omega-6 fats are not inherently bad. They're essential and have roles in cell membranes and signaling. But in excess and in certain biochemical contexts, omega-6 metabolites can promote a low-grade inflammatory state. Even low-grade inflammation matters for the aging brain because it can reduce nitric oxide availability. When nitric oxide dips, vessels are less able to relax in response to demand. For someone with reduced vascular reserve, that means cerebral vessels may not dilate as needed during moments of mild hypertension or exertion, increasing vulnerability to transient low-flow states. Clinically, seniors who get excessive omega-6 exposure from daily large portions of sunflower seeds or sunflower oil blends may complain of persistent low-level symptoms. A mild morning lightheadedness that fades after a cup of coffee, a clouded feeling in the mid-afternoon, or a new slight imbalance when turning quickly. These aren't dramatic strokes. They are fluctuations in cerebral perfusion that accumulate. My practical recommendation is not to eliminate sunflower seeds entirely. Instead, treat them as a garnish. A teaspoon or two as a topping once or twice a week is a reasonable approach for most older adults. If you eat them more often, balance the rest of your fats toward monounsaturated oils like olive or avocado, and pay attention to overall inflammatory signals, new fatigue, new fogginess, or dizziness. Also, be vigilant with sunflower oil in processed foods. Some food labels list sunflower oil as the primary fat in snacks, salad dressings, and commercial baked goods. For people with a history of stroke or unstable blood pressure, consult your clinician about frequency. Next, sesame. Think of tahini, sesame-topped bread, and the toasted seeds sprinkled on dishes. Sesame is nutritionally rich and culturally central in many diets. The physiological mechanism of concern for older adults centers on phytic acid, a natural compound found in the outer layers of many seeds. Phytic acid binds minerals, most relevantly magnesium and calcium, and reduces their absorption when seeds are consumed whole and unprocessed. Magnesium, in particular, helps vessels relax and stabilizes the electrical and mechanical behavior of the cardiovascular system. When phytic acid reduces immediate mineral availability, older vessels that rely on finely balanced mineral levels to buffer pressure changes can temporarily lose some of their responsiveness. Think of this as a pressure buffering system working with one fewer cushion. In practice, this means a senior who regularly eats tahini by the spoonful or sprinkles raw sesame seeds daily may experience episodes of pressure instability. They may feel fine sitting, but stand and get a brief dizzy spell, or notice that their heart seems to race when they bend over to tie shoes. The simplest low-friction approach is to reduce frequency and favor processed forms that lower phytic acid. Toasting sesame and using tahini that has been processed can reduce phytic acid content. Occasional tahini a few times per week, or sesame seeds used as a finishing touch rather than a daily staple, is a conservative plan. If someone relies heavily on sesame for flavor or cultural reasons, combining it with mineral-rich foods, yogurt, cooked leafy greens, or a magnesium-containing supplement under clinician guidance can help maintain balance. Chia seed is the one that surprises most people. It's sold as a hydration aid, a source of fiber, and a convenient thickener. Add it to a smoothie or yogurt and it becomes a pudding. Chia is extraordinarily hydrophilic. The seeds absorb many times their weight in water and form a gel. That property gives chia many useful applications for digestion and satiety. But in an older adult who is marginally hydrated or who eats dry chia sprinkled on cereal without extra fluids, that same property can shift fluid into the gut and away from the circulation transiently. The result can be a modest increase in circulating blood viscosity. Thicker blood and a relative reduction in available intravascular volume combine to make it slightly harder for the heart and cerebral vessels to maintain steady perfusion. The clinical sign to watch for is timing. People often report that after a chia-heavy breakfast without a large cup of water, they feel a mid-morning fog or lightheadedness. This is especially common in mornings when overnight hydration is low. Older adults have a blunted thirst response and are more likely to wake mildly dehydrated. The practical, specific guidance is straightforward. Always pre-soak chia. Soak 1 tablespoon of chia in about 3 to 4 tablespoons of water for at least 20 to 30 minutes. Overnight is fine and often better. If you're adding chia to a smoothie, ensure there's sufficient liquid in the recipe. For those who enjoy a dry sprinkle, avoid that pattern unless you follow it with a full glass of water. Frequency-wise, chia can be used a few times per week when properly prepared. For people on diuretics, with known orthostatic hypertension, or with a history of low cerebral perfusion, discuss chia use with your clinician. Between sunflower, sesame, and chia, we already see the pattern. Seeds are not uniformly benign simply because they are plant-derived. Their chemistry interacts with aging physiology in ways that matter. Sunflower can nudge inflammatory pathways. Sesame can reduce the immediate availability of minerals that buffer pressure. Chia can shift fluids and increase blood thickness if hydration is inadequate. Each effect is modest on its own. But someone who eats mixed seed bars at breakfast, snacks on sunflower seed packets mid-morning, and uses tahini at lunch is stacking multiple small effects. That stacking is what I mean by vascular noise. I want to pause and share a short, real-world example because clinicians sometimes dismiss these patterns as theoretical until they see one play out. Michael is a 74-year-old retired teacher who came to my clinic because he felt off most mornings. He described waking lightheaded, needing to sit at his kitchen counter for a few minutes before he could go downstairs for coffee. His cognition was otherwise intact. He walked independently. Routine blood pressure checks in the office were unremarkable. Michael liked his habits. He had a daily granola that contained a mixed seed blend, plus sunflower seeds on his salad at lunch, and a tablespoon of tahini in his hummus every evening. He drank what he called a little coffee in the morning, about a cup, but otherwise admitted he didn't purposefully hydrate. We made a modest, reversible plan together. He agreed to one change at a time. First, he replaced the daily mixed seed granola with a plain oatmeal and fruit bowl, and reserved sunflower seeds as a garnish no more than twice a week. Second, he soaked a tablespoon of chia overnight whenever he wanted it, rather than sprinkling it dry. Third, he swapped store-bought hummus for a simple homemade batch where he could use olive oil instead of tahini on most nights, saving tahini for special occasions. Finally, he set an alarm that reminded him to drink a full glass of water when he woke and another mid-morning. The result was not dramatic in a dramatic way. There was no miraculous reversal. What Michael reported over 6 weeks was precisely what we expect if vascular noise decreases. His morning lightheadedness diminished, the episodes of midday clouding were less frequent, and he felt steadier getting up in the morning. Balance testing in the clinic was slightly improved. He didn't need any new medications. Importantly, Michael's case doesn't prove seeds caused his symptoms, but it offers a practical template. Simple, reversible pantry changes combined with better hydration coincided with quieter symptoms. For many seniors, that is the exact level of improvement that preserves confidence and independence. Before I continue to other seeds, a quick and important clinical caveat. If you have a history of stroke, clotting disorders, are on anticoagulant medications, or have uncontrolled blood pressure, talk with your clinician before making major diet changes. These are the people for whom individual nuances matter most. I'm offering guidance you can use to start a conversation with your healthcare team, not a substitute for individualized medical advice. Now, one seed that rarely gets attention outside of baking: poppy. The amount of biochemical activity here is subtle but relevant. Poppy seeds contain trace alkaloids that, in most people eating normal culinary amounts, are negligible. In older adults with sensitive autonomic regulation, the system that controls blood pressure and heart rate, small influences on sympathetic or parasympathetic tone can make day-to-day blood pressure responses more variable. That variability can translate into lightheadedness when changing posture, or to brief episodes where the brain's perfusion dips just below the comfortable threshold. For most people, an occasional sprinkle of poppy seed on bread or a bagel is not a problem. For someone who has begun to notice new dizziness or arrhythmic blood pressure readings, it's reasonable to reduce frequency and observe whether symptoms improve. I want to underline a recurring theme. None of these seeds need to be demonized. They are valuable foods with many benefits. The point is context. Age reduces reserve. Small, repeated physiological nudges that would be absorbed without notice at 40 may add up at 70 to produce symptoms that interfere with daily life. At this stage, it's useful to be explicit about practical preparation rules that apply across seeds. First, always favor preparation that reduces anti-nutrient effects. Soak or cook seeds where applicable, and grind seeds like flax to make their nutrients accessible without the shell acting as a mineral binder. Second, hydrate around seed-heavy meals. Have a glass of water with breakfast and a second mid-morning if you consume chia or other swelling seeds. Third, simplify predictable daily intake. Choose one seed you tolerate well and use it occasionally rather than consuming multiple seeds every day. Fourth, read labels diligently and avoid hidden ingredients that can introduce other risks. More on that shortly. Finally, keep a symptom diary for a week when you make changes. Note lightheadedness, afternoon fog, balance slips, and whether those symptoms change after you modify preparation or frequency. When I talk with families and caregivers, I encourage them to look not just at the seeds themselves, but at patterns. A breakfast of the supermarket seed and nut bar, plus a smoothie with raw chia, plus a tahini-based dressing at lunch stacks, several different mechanisms: inflammation, mineral binding, and fluid sequestration. That stacking, again vascular noise, can be the difference between a steady morning and one that begins with uncertainty. I'll stop here for a moment and pick up the next set of seeds with the same methodical approach: what they are commonly used for, the specific way they interact with aging physiology, the clinical signs to watch for, and practical, exact steps to prepare or substitute them safely. In the next section, I will cover cottonseed, flax, and the phenomenon of mixed seed products in more detail, including how cottonseed can hide in oils and why that matters for mitochondrial energy in vascular cells. I'll also give a concise pantry simplification checklist you can implement this week and review a clear step-by-step plan you could follow with your clinician if you have a higher risk history. If any of what I've described so far rings true, if you or someone you care about has new morning lightheadedness, afternoon fog, or unexplained imbalance, these are precisely the issues worth exploring with both practical kitchen changes and clinical evaluation. Next, let's talk about a seed you probably don't think about when you open a bottle of cooking oil: cottonseed. Cottonseed isn't usually eaten as a seed on its own. It hides in the food supply. You'll find it listed as cottonseed oil, or lumped into labels that say vegetable oil or vegetable oil blend. The biochemical concern here is gossypol, a naturally occurring compound in cottonseed. At culinary exposures, the effect is subtle, but it matters because gossypol can interfere with mitochondrial function. In blood vessel walls, mitochondria are the little powerhouses that help smooth muscle cells react quickly and efficiently. If those cells have less energy, vessel responsiveness suffers. Vessels become slower to dilate when the brain needs extra flow, and recovery after a drop in pressure is blunted. For a younger person with plenty of vascular reserve, that slowness is usually irrelevant. For many older adults, it's a small but meaningful loss of responsiveness. Clinically, the pattern to watch for isn't dramatic. A person might feel slightly more tired after meals cooked in cheap, processed oils, or experience a tendency to feel unsteady the day after eating a lot of fried or highly processed foods. Blood pressure checks done in a clinic could be normal, while the patient still reports brief episodes of fogginess or mild imbalance during real-life activities. The practical step is straightforward and low cost. Favor single-source, stable cooking oils, such as extra virgin olive oil or avocado oil in your pantry, and read labels. If a product lists cottonseed oil explicitly, avoid it. If the label says vegetable oil blend, or simply vegetable oil, and the ingredient list is vague, opt for brands that specify the oil, or choose whole food fats instead of highly processed preparations. For commercially prepared foods that you rely on, consider switching to options that use olive or canola oil where possible, and save highly processed seed oil products for rare treats rather than daily use. Now, let's return to a seed we mentioned earlier, but deserves its own careful attention: flax. Many people assume whole flax seeds are the healthiest route because they are more natural. In practice, whole flax has two practical issues for older adults. First, the tough outer shell of whole flax resists digestion, which means that large portions can pass through the gut intact and not release their beneficial omega-3 oils. Second, like other seeds, flax contains phytic acid. When consumed whole and in quantity, flax can contribute to mineral binding and can act like a mild sponge in the gut, drawing water and potentially participating in the same hydration and mineral access issues we discussed with chia and sesame. The safe, effective way to use flax is to grind it fresh and to moderate portions. Grinding makes the oils available without relying on brute chewing, and using 1 to 2 tablespoons of freshly ground flax a few times per week is a reasonable pattern for many seniors. If you buy pre-ground flax, store it in the refrigerator, and use it quickly, oils oxidize and lose benefit. If you notice a pattern of lightheadedness after flax-heavy meals, try a week of avoiding whole flax and a short trial replacing it with ground flax or another source of omega-3s, and track how you feel. A short transition here. You've seen the same themes repeat in different forms. Some seeds influence inflammation, some bind minerals, some alter fluid balance, and some subtly affect autonomic tone or mitochondrial energy. When several of these things occur on the same day, the effects don't simply add, they interact. Imagine your vascular system as a finely tuned radio receiver. One tiny source of interference is annoying but manageable. Multiple small sources of interference. Sunflower-induced inflammation here, chia-driven fluid shift there, cottonseed oil in the evening. Create what I call vascular noise. Vascular noise increases the probability that, at a vulnerable moment, cerebral perfusion will dip below the comfortable threshold. Let me give a concrete example of stacking that many people would recognize. A common convenience breakfast might be a supermarket granola bar filled with mixed seeds and nuts, a smoothie made with raw chia seeds, and a store-bought muffin glazed with oil that lists only vegetable oil on the ingredient panel. That single morning stacks the inflammatory potential of omega-6 heavy seeds, the fluid-sequestering property of dry chia if the smoothie recipe is low in fluid, and a processed oil that may include cottonseed. For a robust 35-year-old with lots of vascular reserve, this is unlikely to cause issues. For someone in their 70s whose small vessels are less adaptable, this stack increases the chance of mid-morning fog, a lightheaded spell when standing, or a subtle decline in balance. The goal is not to outlaw seeds, but to reduce the predictable stacking of multiple small risk pathways on the same day. This brings us to the phenomenon that's become increasingly common on supermarket shelves: super seed mixes and seed-forward processed foods. These products are often marketed as superfoods, and the marketing makes them sound ideal for a quick, healthy life. The problem for older brains is not the concept of nutrient-dense snacks, but rather the chronic, daily stacking of multiple seed chemistries without attention to preparation, hydration, or the rest of the meal's composition. If you eat a seed-packed bar every single day, plus raw chia in a morning smoothie, plus tahini in your lunch dressing, then the small, separate effects that each seed produces can accumulate across hours of waking life. In practice, this looks like a person who reports persistent low-level symptoms: mornings that begin with a little dizziness, afternoons with brain fog that didn't exist a year ago, or a new hesitance walking down a single flight of stairs. If you want to keep seed-based convenience foods in your life, do it deliberately. Choose products where the seeds are prepared in ways that reduce anti-nutrient effects, baked or toasted rather than raw, for example, and avoid daily reliance on multiple seed sources. Consider rotating: a seed bar as an occasional snack rather than an everyday breakfast, chia pudding once or twice a week when properly pre-soaked, and using tahini selectively for flavor rather than as a nightly staple. Practical, immediate changes are the most useful for preserving independence and minimizing disruption to routines. Here is a concise, practical plan that many of my patients and their families have been able to implement without drama. First, simplify your pantry. Pick one seed you enjoy and tolerate well, perhaps a teaspoon of toasted sesame as a finishing touch, or ground flax in oatmeal 2 or 3 mornings a week, and make that your predictable seed. Second, prepare seeds correctly. Soak chia for at least 20 to 30 minutes or overnight to prevent immediate fluid shifts. Grind flax fresh before using and refrigerate. Toast sesame lightly to reduce phytic acid, and avoid eating large volumes of oily seeds or seed mixes by the handful. Third, hydrate intentionally around seed use. Drink a full glass of water when you wake and have a second glass with or shortly after any seed-heavy meal. For many seniors, this means aiming for a steady pattern of fluid across the day, roughly the equivalent of 6 to 8 cups, about 1.5 to 2 liters, as a general target, unless your clinician has advised otherwise for a specific condition. Fourth, read labels and eliminate hidden risks. Avoid products that list cottonseed oil, and be wary of vague vegetable oil blends that do not specify the source. Prefer single-source oils such as extra virgin olive oil or avocado oil for cooking and dressings. Fifth, reduce daily stacking. If you enjoy a seed-containing bar at breakfast, consider making the rest of your day seed-light. Finally, keep a simple symptom diary for a week when you make changes. Note the time you wake, whether you had a seed-heavy meal, any episodes of lightheadedness, afternoon clouding or balance slips, and whether those symptoms improved as you altered preparation or frequency. A week is usually long enough to observe meaningful trends. Let's dig a little deeper into hydration, because it's both common and fixable. As we age, the sensation of thirst blunts, and overnight dehydration is common. That means the first hours after waking are a frequent time for low intravascular volume, and that coincides with when people often eat seed-rich breakfasts. When a hydrophilic seed like chia is present, or when bulked-up fiber moves fluid into the gut, the combination of mild overnight dehydration plus a fluid-sequestering food can transiently reduce circulating volume. Practically, start your day with water. For most people, I suggest a deliberate glass upon waking and another mid-morning if a seed-rich meal is on the menu. Monitor urine color as a simple feedback signal. Pale straw-colored urine usually indicates reasonable hydration, while darker urine suggests underhydration. If you take diuretics or have heart or kidney disease that changes fluid recommendations, follow your clinician's instructions about daily fluid targets and timing. Another concrete pantry tip concerns oils and prepared foods. When shopping, scan ingredient lists for cottonseed oil or for vague vegetable oil listings. Some lower-cost brands use cottonseed or a mix that includes it because it is cheap and stable for frying. If a label is unclear, choose an alternative. Many brands of canned tuna, packaged snacks and frozen convenience meals now specify the oil used. Favor those that use canola, sunflower, sparingly, or olive oil, depending on your tolerance and the rest of your diet. When in doubt, use whole food fats at home, olive oil for salad dressings and light sautéing, and avocado oil for higher heat cooking. Reserve processed seed oil containing foods for occasional use rather than daily consumption. For families and caregivers who prepare meals for older adults, the simplest rule is to prioritize predictability and moderation. Offer one seed-containing item in a day and prepare it to reduce anti-nutrients. Soaked chia pudding, a sprinkle of toasted seeds on a small salad for texture, or a tablespoon of ground flax mixed into oatmeal. Avoid combinations like seed bar plus smoothie with raw seeds plus tahini dressing in the same day. When you suspect that a food pattern might be contributing to dizziness or fog, try a short trial of reduced seed intake and improved hydration for 2 weeks and record any changes. Often the improvement is modest but meaningful. Reduced morning lightheadedness, a clearer afternoon, or steadier balance when standing. These are the practical outcomes that help preserve independence. There are a few subgroups of patients where the conversation must be more cautious and clinician-guided. If you have a history of stroke, a known clotting disorder, are taking anticoagulant medications, or have unstable blood pressure, bring this discussion to your healthcare provider before making major dietary changes. Some seeds and foods can interact with medications or affect clotting in ways that require individualized adjustment. Likewise, if you have heart or kidney disease that affects fluid targets, speak with your clinician about how to time fluids and which seed preparations are safest. The goal of this script is to give you concrete starting points for conversation, not to replace individualized medical planning. Now I'll return to Michael for a moment because practical examples help translate theory into daily life. After the initial 6-week improvement he reported, we adjusted his plans slightly to help sustain benefits without removing pleasures. He decided to keep tahini for weekend hummus and special dishes, and he allowed himself a seed-based snack occasionally on outings. Importantly, he continued the habit of soaking chia and drinking a full glass of water when he woke. At 3 months, Michael reported fewer episodes of morning unsteadiness and felt less anxious about leaving the house alone. He hadn't lost any cultural food traditions. He had simply redistributed them across the week and prepared them differently. That modest, sustainable approach is the model I recommend. Retain foods you love, but respect preparation, spacing, and hydration. You may be wondering what a realistic week looks like with these adjustments in place. A sample approach would be to have ground flax in your oatmeal 2 or 3 mornings per week rather than every day. Use toasted sesame as an occasional garnish rather than a daily spoonful of tahini. Reserve chia pudding for 2 mornings a week, but make it with overnight soak and plenty of added liquid, and avoid daily seed bars or processed seed-heavy convenience breakfast items. For cooking, keep extra virgin olive oil as your go-to for dressings and low-heat sautéing, and use avocado oil for higher heat cooking. Keep store-bought fried or heavily processed foods as treats, not staples. This pattern reduces stacking, minimizes anti-nutrient exposure, and stabilizes hydration demands across the day. A practical checklist you can implement this week is simple and actionable. Choose one seed to use regularly and make it a small portion. Soak chia overnight when you plan to eat it and avoid dry sprinkling without water. Grind flax immediately before use and store ground flax in the refrigerator. Toast sesame to reduce phytic acid and treat tahini as an occasional flavoring rather than a nightly staple. Replace ambiguous vegetable oil products with clearly labeled single-source oils or olive avocado oil. Avoid daily mixed seed bars and seed-heavy granolas in favor of simpler breakfasts like oatmeal with fruit, and set 2 small hydration cues, 1 glass on waking and 1 glass with or shortly after breakfast. Keep a short symptom diary for 7 to 14 days and note any changes in morning lightheadedness, afternoon fog, or balance. If symptoms persist, or if you are on blood-thinning medications or have a history of stroke, bring your diary to your clinician to guide tailored adjustments. Let me be clear about one important point. None of these changes guarantees that a stroke will be prevented or that existing vascular disease will be reversed. What they do is reduce predictable, reversible contributors to what I call vascular noise, small, daily factors that can tip a vulnerable brain into brief, low-flow episodes. These episodes are the kinds of things that make people lose confidence walking downstairs, worry about driving, or become reluctant to participate in social activities. The aim here is preservation of function and autonomy through low-friction reversible steps that can be discussed with your clinician. I want to briefly address common questions I hear in clinic. People often ask whether supplements can replace the need to prepare seeds differently. Supplements sometimes have a role in correcting true deficiencies, but they are not a substitute for correct food preparation and hydration. For example, if someone has low magnesium on testing, a clinician-directed supplement can help, but relying on supplements to override chronic consumption patterns of mineral-binding foods is not the same as changing how you prepare and pace your diet. Another frequent question is whether patients on blood thinners should avoid all seeds. That is not a blanket rule. Instead, patients on anticoagulants should discuss specific seeds and preparations with their prescribing clinician, because some seeds and herbal products can interact with medication metabolism or affect clotting. As we close, I'll summarize the essential take-home messages I want you to hold on to. First, seeds are not inherently dangerous, but some seed chemistries interact with age-related changes in vascular reserve and can increase vulnerability to low-flow brain events. Second, preparation matters. Soak chia, grind flax, toast sesame, and avoid vague vegetable oil blends that may include cottonseed oil. Third, simplicity and spacing are protective. Choose one seed pattern you tolerate well. Avoid daily stacking of multiple seed types and hydrate intentionally around seed-heavy meals. Fourth, keep a short symptom diary when you make changes, because small improvements in morning lightheadedness or afternoon clarity are often the clearest indicators that the adjustment is helping. Fifth, consult your clinician if you have a history of stroke, clotting disorders, are on anticoagulants, or have uncontrolled blood pressure before making major dietary changes. If this message matters to you, please share it with a friend or family member who eats seed-heavy breakfasts or prepares meals for an older loved one. Conversations about small, practical changes can make daily life steadier and safer for the people we care about. And finally, if you have specific health concerns or are taking medications, bring what you've learned here to your clinician so you can make personalized, safe choices. I'm Dr. Emily Carter. Thank you for spending these minutes to learn how small, thoughtful changes in preparation, hydration, and pantry choices can protect the aging brain and preserve independence.